Member Mike, 1, 2, 3, test, test, test. Witness Mike, 1, 2, 3, testing, 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 1, 2, 3. Second witness Mike, second witness Mike, 1, 2, 3, 1, 2, 3, test, test, test.
Member Mike, check 1. Close, far away. Member Mike, check 1. Witness Mike, check 1. This one's the low one. Far away. Far away. Close up. Far away. Witness Mike, check 1. Yep.
Okay, all right. Okay, are we ready? John, are we ready?
Yeah, let's just make sure Shalane gets in.
Okay. How are you? Good. No, that's what I'm gonna do. So I'm gonna talk about the pictures, and then I'll yield to you for the pictures, and then we'll go to Shalala for the opening on the legislation. I'll go to you for the opening on the legislation. Okay? Okay. All right, Rules Committee will come to order. So before we get to the bill at hand, I want to acknowledge that we spruced up the place over the district work period. I want to especially thank Samantha Russell on our staff for leading the effort to get all of this wonderful artwork in place. We brought a little bit of Worcester, Massachusetts to Washington with the two reproductions to my right. The first is Across the Rooftops by Lawrence McCoy, which beautifully captures the three-decker homes that Worcester is known for. The second is Apple Orchard by Joseph Greenwood. He was a Worcester native who painted it in 1903 to show springtime in the Commonwealth. I want to thank the hardworking individuals at the Worcester Art Museum, including Claire Whitner and Allison Rosenberg and Sarah Gillis and their teams for working with us to get these pieces displayed here in the Capitol. Hanging on the wall to my left is a reproduction of First View of the Lady by Mort Kunstler. Back in the 1980s, this painting was part of a series used to raise money to renovate Ellis Island and the Statue of Liberty. We hung it here as a reminder of the hope that America embodies and the values that immigrants have brought to our country for generations. It is also a reminder that all of our families, with the exception of Native Americans, came here as immigrants. Behind me to my right is a photo of Mary Thompson Fisher, or Teata. She was a Native American storyteller and actress who performed for everyone from the President of the United States to the King and Queen of Great Britain. Teota was a member of the Chickasaw Nation. She was also the great aunt of our distinguished ranking member, Tom Cole. So we chose to display this piece, which is on loan from the University of Science and Arts in Oklahoma, because I wanted to recognize not only his proud heritage, but the legacy and culture of all Native Americans, which is interwoven as part of the fabric of America. And lastly, behind me to my left is a reproduction of Winter at the Capitol, a night session. The piece painted by Charles Graham in the late 1880s. We're known at the Rules Committee for meeting sometimes very late at night, although we have dramatically improved on that in recent years. But I still thought it was fitting to hang it here. So I hope it reminds us not just of this beautiful building, but of the privilege we have been given to serve in this building and to help the people we represent. Now, if the ranking member has anything he wants to add regarding the artwork, I'm happy to yield to him, and I will come back to the gentleman later for his remarks on the legislation, but I yield to him now for anything he wants to say.
Mr. Chairman, I want to start personally thanking you and thanking Samantha and your incredible staff for the marvelous job. Obviously, I'm extraordinarily proud that Teata was my great aunt. She lived to almost 100 years old. She was born in 1895 in Indian Territory. Her father, my great-grandfather, was the treasurer of the Chickasaw Nation, and she had an extraordinary career. As you correctly pointed out, she did actually the first state entertainment in the Roosevelt White House in March of 1933. She was a favorite of Mrs. Roosevelt, performed at Hyde Park for the King and Queen of England when they visited the United States in 1939, performed all over the world. You made 65,000 Chickasaws very, very happy. She actually attended what was then the Oklahoma School of Women, College for Women, to get her college education. If you go there today, there's about a 15-foot statue of her on campus. The main performing hall is named for her. It's the very stage she performed on. It's an historic building, but she represented Native American culture everywhere. You know, at a time when a lot of people thought Native Americans were vanishing, they clearly weren't, and they're here today. But it's a very proud part of my heritage, but also my state's history. Again, if you go to the Oklahoma Capitol today, you'll find a portrait of her hung in the state capitol. And but this is a magnificent tribute, and I want to thank you again. And just note for the record, once again, the Rules Committee, the home of civility in the House of Representatives, is setting the stage. And we have our differences and we have our debates, but you have done a marvelous job as your predecessors, Chairman Sessions and the late Chairman Slaughter did as well in setting the right tone for this committee. It's a committee that has to get its job done to prepare the floor so that our colleagues can bring the important legislative matters to the floor and do so in an appropriate fashion. So I just, again, want to thank you for your personal generosity of spirit for doing this and tell you how much I appreciate, too, the art from your home. We used to have a lot of Indians in Massachusetts. We still got some there now, and we've worked together. I see my good friend, Mr. Pallone. We occasionally have differences. We may even have a difference today on this legislation, but my friend, the chairman, has also been a leader on Native American issues, as has Mr. Walden next to him. So we have a lot of people in this room that have done a lot on a bipartisan basis to move important legislation for the first Americans. And this is a symbol of that and another step in that right direction. So thank you, Mr. Chairman, for your leadership, for your friendship, and for the manner in which you run what could be a contentious committee, but is actually, I think, a committee that this body can be very proud of under your leadership.
Well, thank you very much, and I appreciate your words and also your advocacy on behalf of our Native American population. Nobody in this Congress has been a bigger champion than you, and we try to follow your lead. So having said that, now let me turn to the bill that we're considering today, H.R. 2339. This is a bipartisan bill. Congresswoman Shalala has been a strong champion of this legislation, so I want to yield to her to discuss its importance as one of the principal sponsors of the bill, and then I will turn to the ranking member for his comments.
Thank you, Mr. Chairman. I appreciate the opportunity to talk about this landmark bill, H.R. 2339, the Protecting American Lungs and Reversing the Youth Tobacco Use. And I urge all of my colleagues to support this bill and the rule. I've worked on tobacco issues for years. When I was Secretary of Health and Human Services, we knew that we were facing a problem with youth usage of tobacco products, particularly cigarettes. In 1997, 24.6% of all 12th graders reported daily use of cigarettes, and 36.5% reported some use in the past 30 days. Thanks to smart national policies, a national and state commitment to reducing cigarette use among children, those numbers dropped to 3.6% and 7.6% by 2018. This was one of the great public health accomplishments of the last 30 years. Nearly 90% of adult smokers began smoking before they were 18. If you don't start smoking as a child, it's very unlikely you will smoke as an adult. This isn't a secret. Public health officials know this, and tobacco companies know this too. They also know that nicotine is highly addictive. This put tobacco companies in a bind. If children and teenagers have stopped using cigarettes, and 90% of all adult smokers began smoking as children, how can they maintain their base of customers? Their answer has arrived in the form of new technology, e-cigarettes and vaping products. E-cigarettes have helped them stop smoking cigarettes, and this is a good thing. However, tobacco companies haven't left things at that. They knew that the pipeline of lifetime smokers was dwindling, so they started marketing new vaping products to young people through Instagram ads and influencers and other social media platforms. They also handed out free vaping products at musical events and at movies. Today, 26.7% of 12th graders vaped in the last month. This rate has more than doubled in the last 2 years alone. In 2010, only 1.5% of 12th graders reported vaping. We banned flavored cigarettes in 2009 because they appealed to children, and encouraged them to take up smoking. Tobacco companies pivoted. They switched to flavored vape products and flavored cigarillos because these products are not held to the same standard, even though they are tobacco products and contain nicotine. In 2018, 67% of high school students and 49% of middle school students who used tobacco products in the past 30 days reported using a flavored tobacco product. So while kids can't buy cotton candy or banana smash cigarettes, they can buy those flavors in vaping products or in cigarillos. And I want to show you these vaping products. For the record, nicotine has health effects beyond addiction. Nicotine exposure damages adolescent brain development, and brains are not fully done developing until the mid-20s. Nicotine also contributes to the hardening of the arterial walls, which in turn may lead to a cardiac event. Nicotine exposure during youth and young adulthood is particularly dangerous. It can change the way the brain works. It can lead to a lifetime of addiction, in some cases causing long-lasting effects, such as increased impulsivity and mood disorders. We've made a lot of bipartisan progress on this particular public health issue. We raised the age to buy tobacco products to 21 in the omnibus budget bill, and the administration has enacted a limited flavor ban. However, the administration's flavor ban is too narrow. It only restricts flavors in closed pod products like Juul and still allows for flavored products in a variety of other forms, including as e-liquid. This is an example of e-liquid. Companies can get around the administration's ban by selling refillable Juul-like pods that can be filled with these liquids. This is a Juul-like pod, which can be refilled. And of course, any high school kid can pass this on as a marker. This is another one. This is a watch, and it actually tells time. But this is a refillable pod that comes out. All of these aren't exempted under the president's rule. Further, these are the disposable ones: mango, blueberry, peach. Let's pass these around. I want them back. These are called puff bars. And what kids do is they put them in their sleeves and keep them from their teachers. And there is evidence that teens are already switching to using these products over products like Juul's. It's time to ensure our children don't face a lifetime of nicotine addiction. It's time to finally pass a bill that protects their health. Let me show you the final project. My assistant will stand up. This is a hoodie. On this side, they click in one of these forms and then hide it. And they sit in class and they can inhale on one of their strings. This is what's going on to addict our children. This is a public health crisis as large as the one we took on in the 1990s. It's time to ensure that our children don't face a lifetime of nicotine addiction. It's time to finally pass a bill that really protects their health. This is about our children. Thank you, Mr. Chairman, for letting me speak for a moment about this bill. I yield back.
Thank you very much. I'm happy now to yield to our ranking member, Mr. Cole.
Thank you, Mr. Chairman. I want to thank my good friend from Florida. There's actually some areas that we can work on in this, but the majority's presented us, in my view, with a bill as targeting youth smoking. It's instead a wide-ranging bill that impacts the entire tobacco industry. I think we need to be clear about what the effects of this legislation will actually be. Certainly, preventing youth smoking is a worthy and lofty goal, one that both Republicans and Democrats can support. Late last year, both parties came together to pass legislation raising the minimum age to purchase tobacco products from 18 to 21. That's a very good thing. That was a good bipartisan piece of legislation that will go a long way toward achieving our shared goal. But Tobacco 21 became law just over 2 months ago. And even though only a short amount of time has passed, the majority is now seeking to pass another bill. This one, in my view, overly broad and overly prescriptive and ultimately counterproductive without any indication that it's actually necessary. Today's bill is a collection of policies that will affect the entire tobacco industry rather than targeting youth smoking specifically. Instead, it's a broadside that will completely change the industry and will affect every single tobacco product offered for sale in America, both now and into the future. Moreover, it will deny adults access to products they are legally allowed to use and will likely do nothing more than push products into the illicit market, all the while doing nothing to prevent youth from smoking. To start, the bill completely bans the use of flavors of any kind in any tobacco product, not just vape products. That means that tobacco products that ordinarily use flavors, like hookah tobacco and some pipe tobaccos, will no longer be able to be made. This ban extends even to methanol, a very popular flavor in tobacco products. This denies Americans of legal age to purchase tobacco products the right to use products of their choice, and again, likely means that these products will be pushed into the illicit marketplace. The majority has not presented any evidence that the approach they are following with this bill will actually result in reducing youth smoking, nor do they make clear why this policy, a draconian ban, is superior to the administration's targeted actions to address youth e-cigarette usage through prioritizing enforcement actions, in addition to the new Tobacco 21 law. The result of this measure will be to go far beyond youth smoking and youth vaping, and will instead simply ban access to tobacco products that are used legally by adults. While I agree that with the goal to eliminate youth smoking and vaping, it's important to remember that vaping can play an important role in helping current smokers to stop. A recent study published in the New England Journal of Medicine in January of 2019 found that e-cigarettes were significantly more effective than nicotine replacement treatment. Instead of supporting these types of alternatives, the majority is seeking to micromanage what adults can and cannot do. I fully support the stated goal of the legislation and fully support policies like Tobacco 21, but I also support the right of Americans of legal age to use these products if they choose. And that, I think, is where the bill goes off the rails. There are other harmful policies in the bill, Mr. Chairman. The bill expands the authority of the Center for Tobacco Products to collect user fees and allows the CTP to continue to operate without needing further congressional authorization, appropriations, or oversight. It bans most remote sales of tobacco products and vaping products, thus forcing many businesses that otherwise operate legally to close. And it does nothing to address the ongoing use and abuse of illicit products containing THC, despite the fact that many such products are currently being marketed with kid-friendly flavors. We should do better than this, Mr. Chairman. I think, given the chance, many members on both sides of the aisle would like to make changes to this bill. I think it would behoove the committee to make as many amendments in order as possible, despite signaling your intention to close the process, to allow every member of Congress to have their voice to be heard. With that, Mr. Chairman, I yield back.
I thank the gentleman for his statement, and I'd like to welcome our witnesses to provide testimony on H.R. 2339, the Protecting American Lungs and Reversing the Youth Tobacco Epidemic Act of 2020. Chairman Pallone, Ranking Member Walden, Mr. Schwazi, and Mr. Ferguson, we're delighted that you are here. Anything you brought in writing will, without objection, be entered into the record. I now recognize the gentleman from New Jersey, Chairman Pallone.
Thank you, Mr. Chairman. I will submit my full statement for the record, but I'm not going to read it because, first of all, I think that Congresswoman Shalala, who's the co-sponsor, after me and has done so much work on this bill, basically laid out what the bill is all about. And I would maybe prefer to kind of respond to Congressman Cole's critique, if you will, of the bill and try to respond to some of that. But I can't help but thank you for your positive comments about my help with Indian country. I'm very proud of the fact that we work together on Indian issues. The reason that this bill is needed is because although I was very supportive of raising the age when you could buy tobacco products to 21, from 18 to 21. And I appreciate the fact that on a bipartisan basis, we adopted that in the omnibus bill. The fact of the matter is that the vaping epidemic primarily is with much younger people, for whom would not have been able to buy tobacco even when it was 18. I started out with this a few years ago when I went to a middle school in Woodbridge, New Jersey, in my district, which was 6th, 7th, and 8th graders. And that's where the vaping epidemic, that's sort of the epicenter, if you will, of the vaping epidemic. Kids get addicted to vaping in the same way they get addicted to any kind of tobacco product at a young age, 12, 13, 14 years old. And it was all about flavors. In other words, they were convinced, this is 5 years ago, so it was before the recent problems that we've had with vaping this summer. They were all convinced that e-cigarettes were not harmful, that they did not contain nicotine, and they mainly focused on them because of the flavors. The fact that they were that the tobacco, the harshness, if you will, of the tobacco is covered by menthol, mint, bubble gum, mango, whatever it is. And this is what happened, in the 90s or even before, when cigarettes. When we really cracked down on cigarettes and had all the prohibitions on advertising and so many other things and the warnings, e-cigarettes were not deemed a tobacco product, and so those rules did not apply, and they still don't apply. And so basically what we're trying to do here is to say that we will treat e-cigarettes in the same way that we treat other tobacco products. They will be under the same advertising restrictions. So, you won't see them on TV, you won't see them at the sports events for the most part. And you're specifically prohibited from targeting kids. But that isn't enough, because what happens is the young people are enticed, if you will, by the flavors that mask the tobacco, and they usually buy the product online. And so the bill says that there'll be no online sales of tobacco products, because we know that that's how kids buy tobacco products, whether it's e-cigarettes, regular cigarettes, or whatever it is. In addition to that, though, and I can't stress enough, the flavors. If you don't ban flavors, and you can't just ban some flavors and not others, because some people have said to me, well, why do you have to include menthol? Kids don't smoke menthol. The fact of the matter is that 70% of the kids who use e-cigarettes use menthol or mint cigarettes. So there's no distinction here. Flavors are flavors. They mask the roughness, if you will, of the tobacco, and they entice young people. So this is really a comprehensive bill to try to basically get kids not to start vaping or using flavored cigarette products and not being able to buy them because they won't be able to buy them online. And the main thing that is amazing to me is that even today, even though after all the deaths and the things that we heard about this summer, there's so many kids and even adults who think that vaping is a cessation method. And I know you even mentioned that with this report in one of the journals. The CDC says to us, and I can give you the information, I didn't bring it with me today, that there's no indication in a scientific way that these vaping products, anybody moving to them or starting to them, is going to make people cease smoking or cease using tobacco. They're highly addictive. The level of addiction from vaping is greater in many cases, depending how you use it, than it is for a cigarette. So I just want to dispel this idea that e-cigarettes are a cessation device, that if we allow flavors, we don't, that's going to, we can still get at the epidemic for kids. We can't. And so we put this together in the committee. Granted, it was not supported by most Republicans, some Republicans, because we were trying to get at this epidemic. And the bottom line is that if we don't do something like this in the next few years, I am convinced, and the evidence shows, that all of the efforts that were made, that Congresswoman Shiller said, to try to get people to stop smoking cigarettes, all the efforts that were made to get Americans to use less tobacco are simply going to go away. We're almost at the point now where vaping has gotten to the point where it's so prevalent that it's wiped out all the gains that we made in the last 10, 20, 30 years in trying to get people to stop smoking cigarettes. So I appreciate your support and any questions you might have.
Thank
I'm
you.
going to let, I'm going to ask, Tom is here, Swayze from Ways and Means, and he'll explain how we've incorporated the tax portion and how that's going to be used for cessation.
First, we're going to go to Ranking Member Walden.
Thank you, Mr. Chairman. Appreciate the opportunity to be back before you. I know all of us have a deep concern about youth tobacco use. We all know this. Smoking is harmful, and we must do what we can to prevent tobacco use by children. For years, we saw tremendous progress being made in this effort, reducing tobacco use among minors. Although smoking rates among the young continue to decline, there's been a huge surge, millions of people using these e-cigarettes. And I just want to say, I guess Ms. Shalala's stepped out, but when I was in high school, I was student body president. I led an effort before the school board to get smoking out of the bathrooms. I was a rabid anti-smoker, the only member of my family who didn't smoke. And I was successful. We actually created an outdoor smoking area by permit with a fee and parental approval. And you had to be over 16. That was a long time ago, but we got it out. And I've been fighting for some of these issues for a long time. And to her point, if you start smoking as a kid, you're going to get hooked. And so we share that as a common goal. How we get there is the challenge before us today. The use of traditional tobacco products by children declined over the past decade, while the use of e-cigarettes increased by 3.6 million youth users in 2018 to 5.4 million in 2019. That increase is alarming. We all want to take action to reduce the accessibility and use of these products by minors. However, despite the name, the Protect the American Lungs and Reversing the Youth Tobacco Epidemic Act is actually a solution is not a solution to this problem. The bill would prohibit the marketing of flavored electronic nicotine delivery systems, including e-cigarettes. However, the FDA, under President Trump, has already removed most of the products from the market and has stated they will take additional action against any products found to be targeting children. And I would draw your attention to the statement from the FDA where they said if they see a product that's targeted to kids, the agency will not hesitate to target that product. For example, FDA will take action against any product regardless of whether a product is cartridge-based, disposable, or flavored. If it's targeted to minors, its marketing is likely to promote youth use, or if the manufacturer has failed to take or is failing to take adequate measures to prevent minors' access. Additionally, the FDA intends to issue an important alert in the near future and refuse admission of certain unauthorized e-cigarette products that are imported or offered for import into the United States where warranted and as informed by agency enforcement activities. Now, additionally, under current law, there's a higher standard that e-cigarette manufacturers will have to meet starting May 12th of this year. So in addition to passing T21 at the end of last year, saying that you have to be at least 21 years of age to have any of these products or use them, May 12th begins the next phase. Any company wishing to manufacture and sell e-cigarettes, including those with the flavors in the United States, will have to prove their products are, quote, appropriate for the protection of public health and receive marketing authorization from the FDA. So that's coming in just a couple of months. While still a high bar to meet, this standard recognizes the benefit that less harmful alternatives may provide for current users of traditional tobacco products. However, under the bill we're considering today, a manufacturer would have to demonstrate that their product will reduce smoking rates in order to receive authorization. We believe that's an impossible standard to meet, and these products would likely never be marketed under this requirement, even if FDA determines there's a public health benefit. Now, the title of the bill implies the legislation will reverse the recent surge in youth tobacco use. Yet the provision of the bill that prohibits flavors for all tobacco products will do nothing to reverse this troubling trend. Data for the Centers for Disease Control and Prevention, the CDC, show there's been a decline over the past decade in youth use of traditional tobacco products that this bill targets, including smokeless tobacco products and cigars. Between 2011 and 2019, cigarette use declined among high schoolers by 10%, cigar use by 4%, and smokeless tobacco by 3%. The data show we can reduce youth tobacco use without eliminating legal products meant for adults from the market. The legislation also prohibits the manufacture and sale of menthol combustible cigarettes, despite the existing authority of the FDA to do so if it determines that it's necessary to protect the public health based on the scientific data. This is a decision that should be made by the FDA based on sound science. Finally, I remain concerned the legislation does nothing to address the use of illegal marijuana and THC vapor products. In fact, it could actually increase demand for these dangerous products and other counterfeits. The CDC confirmed that vitamin E acetate, used as an additive to cut THC-containing e-cigarette products, was strongly linked to the drug illnesses that were reported last year and resulted in multiple deaths. But this legislation does nothing to address the use of these illegal products, despite the fact they also are marketed to children with kid-friendly flavors such as cotton candy. Those of us in states like Oregon, Colorado understand what's going on in this area. Current tobacco users will be pushed underground to illicit markets to fill the void if they can suddenly no longer purchase their products of choice through legal channels. These products are addictive and designed so users cannot simply quit. Without accounting for this reality, the legislation will actually push individuals to more dangerous and unregulated products. That's why I'm again offering my amendment that requires the FDA to consider whether the denial of a marketing application for a flavored ENDS product will increase the likelihood that consumers will purchase illegal and adulterated products through the black market when determining whether a flavored product is less harmful than an unflavored ENDS product. I believe when determining relative harm, it's important the agency consider that consumers may seek more dangerous, unregulated products if regulated flavored products are unavailable. It's obvious the bill goes well beyond addressing youth tobacco use. It eliminates consumer choice for adults and access for millions of law-abiding adults, while also ignoring another real public health threat that's emerged from the use of counterfeit products and illicit THC vapor products. We can reverse the youth tobacco epidemic through carefully crafted policy solutions like T21, we did that together, and age verification requirements without violating the civil liberties of law-abiding adults by imposing sweeping federal prohibitions on legal products. With that, Mr. Chairman, I yield back.
Thank you, Mr. Walden. The gentleman from New York, Mr. Swazi, is recognized for his testimony.
Thank you, Mr. Chairman, and thank you, Mr. Ranking Member, and to all the members, thank you for being here. I know you spent a lot of hours in this room, and we appreciate the work that you do. I just want to point out, as a matter of personal privilege, before we start, your new artwork in this room. The artist responsible for this image on the wall of the immigrants is Mort Kunstler, who's from my district, who's still alive and is a good friend and supporter of mine. Let me first say that I'm sure that everybody in this room has heard the stories on the news about, and from young people about the problem with youth vaping in America. I became particularly focused on this issue last year when a group of mothers, parents against vaping e-cigarettes, told me stories of high schools filled with student vaping. I then spoke to my children, including my 16-year-old son, and I couldn't believe how commonplace it was that kids are vaping wherever they can. And I think the products that Secretary Shalala showed earlier about the different ways that kids are using vaping products is getting more and more prevalent. We need to act now to try and stop this crisis. That's why I support H.R. 2339 and urge the committee to adopt an appropriate rule for its consideration. This bill includes my bill, the Protecting American Lungs Act, which passed out of Ways and Means Committee with bipartisan support. This legislation will establish much-needed tax parity between vaping products and cigarettes. It will tax nicotine, a harmful and addictive substance, at the same rate whether you get it from e-cigarettes or traditional cigarettes. Importantly, my bill includes an exception for FDA-approved nicotine replacement therapies, which means that if a company can prove that their product is a legitimate cessation device, that nicotine will not be taxed. My bill has the support of over 50 public health, medical and education organizations, including the American Academy of Nursing, the American Academy of Pediatrics, the American Cancer Society, Cancer Action Network, American Heart Association, the American Lung Association, the American Medical Association, and the Campaign for Tobacco-Free Kids. These groups agree that one of the best ways we can stop people from using vaping products is to tax them. For young people especially who have less money and higher price sensitivity, taxes on vapes are an effective way to decrease usage. In fact, according to the Campaign for Tobacco-Free Kids, every 10% increase in the cost of cigarettes or smoking devices leads to a 4% less overall smoking and 7% less youth smoking. I know that some people raise their voices against this effort. We've heard it all before when we fought to raise cigarette taxes. Some will say the science is not yet conclusive. Others will advocate for free choice or say this is typical taxing government. When all is said and done, the opposition will come from those representing big tobacco who put their nicotine interests ahead of our children's health and proven public policy. In my home state of New York, despite intense industry opposition, we raise cigarette taxes and have some of the lowest rates of smoking and smoking-related illnesses. That's because of the directly related to the high cost of these products, because of the high taxes, has resulted in some of the lowest rates of smoking and lowest rates of smoking-related illnesses. We can save lives with this bill by stopping the youth vaping epidemic. That's an opportunity we can't pass up. This bill also includes the bipartisan inhaler coverage and Access Now, or the ICANN Act, introduced by Congressman T.J. Cox and my Ways and Means Committee, Terry Sewell. This bill, which unanimously passed out of Ways and Means Committee, will remove a barrier to treatment for asthma patients by requiring high-deductible health plans to cover inhalers and nebulizers to treat chronic lung conditions like asthma. Because of this bill, those with chronic lung disease will no longer be forced to delay care, which studies have shown leads to worse health outcomes, more emergency room visits, and higher long-term costs. Thank you again for allowing me to speak, Mr. Chairman, and I urge the Rules Committee to adopt the appropriate rule so that we consider this on the House floor, and I yield back.
Thank you, Mr. Swazi. The gentleman from Georgia, Mr. Ferguson, is now recognized for his testimony.
Thank you, Mr. Chairman and Ranking Member, other members of the committee. I appreciate the chance to be with you today. A lot's been said about this bill, and I'll tell you, like my dear friend from New York, I also have a 16-year-old son. And when I have conversations with him about this particular issue, no doubt vaping is a real problem among our younger population. It is something that we should fight. However, this bill goes way beyond what we think will be effective in that fight. And so as we go through this, and I go through my testimony, I look at it through the eyes of not only being a father, but also a healthcare provider, someone who has counseled patients over the years on smoking cessation and really have seen the effects of long-term smoking in my patients within my dental practice. I know this subject firsthand, and I know the importance of it. However, this bill, quite candidly, has some contradictions and some areas of concern that I think that we should talk about. As has been talked, as we have said before, there have already been some major steps taken. One of the things is the T21 legislation that's been previously mentioned, and that is a really good piece of bipartisan legislation. But I will tell you, the next piece of this is education. Besides raising the age, continuing to educate our youth is an important part of this conversation. You simply cannot legislate these problems away. Education is vitally important. And that is something that we need to continue to push on at every point from the federal, state, and local level, whether it's in the schools or whether it's in the healthcare provider offices. I cannot stress that enough. Education is as effective as the T21 component. Next, I find it very interesting that as we go through this, we aren't dealing with one of the fundamental problems with e-cigarettes, and that is the vitamin E acetate that is used with so many of the illegal or illicit drugs that are used in vaping. When we talked about this bill in the Ways and Means Committee, so much of the conversation was about lung damage. And yet this bill does not address this. Matter of fact, I want you to think about sort of one of the situations that I'm on bar, and I hope that the ranking member here won't mind me using his words. I had a very interesting comment earlier today. In his home state of Oregon, if this bill goes into effect and menthol cigarettes are banned, a 21-year-old can walk down the street and smoke marijuana, but will be out of compliance and will be violating the law by smoking a menthol cigarette. Think about that. If we are going to go hard after lung damage, then shouldn't we address all forms of lung damage? Okay, and I find that to be a very interesting contradiction. Second thing I want to talk about is the products that this bill will ban. Some of these, we talk about these in terms of flavored tobacco products. We talk about these in terms of whether it's smokeless tobacco, cigars, or menthol. But I want to read a short list of the products, the name brand products, flavored products that would be, in fact, banned. Newport, Salem, Cool, L&M Green Pack, Marlboro Green Pack, Marlboro Gold, Marlboro Smooth, Camel Crush, Camel Green, Pall Mall menthol variants. Under the smokeless tobacco, Grizzly, Big Mountain, Copenhagen, Husky, Kayak, Kodiak, Longhorn, Red Man, Red Seal, Skoal, Stoker's, Timberwolf, Hawken, Levi Garrett. Under flavored cigars, Black and Mild, Prince Albert, Middleton's, White Owl, Swisher Sweets, Dutch Masters, Backwoods, and many more. This is not a complete list. These are the products right now that are legal that adults can use, and you're banning the flavor and you're dictating choices for law-abiding adult Americans. And not to sound snarky, but what's next? Do we determine that alcohol, in an attempt to stop youth alcohol consumption, should we call Anheuser-Busch and tell them to no longer produce Bud Light Lime? Should we go after the flavors in the hard seltzers? Where does this stop, and at what point does the government stop reaching into the lives of individual citizens? I think it's an important question that must be answered. We have gone through, and I won't go through much of the testimony that's already been offered here, but I think another important thing to think about is to think about in many communities the convenience stores and the small corner grocery stores. Think about the impact that this will have on those small businesses as well. It's reported that almost 30% of the revenue in many of these small businesses come from tobacco products, legal tobacco products that adults are choosing to use, informed adults are choosing to use. If that revenue stream goes away, think about what will happen in many communities. Will these stores be able to support themselves? And quite candidly, many of these stores are opened by immigrants coming to this country to make a better life. I know in my district, in my hometown, many of the stores that are opened by members of the Indian community. This would simply wipe out many of those small family businesses, and that's not fair to them. I think as we go forward and we continue this discussion tonight, I think it's important to remember that we are reaching in, and this is an attempt at the federal government to go beyond what we all agree is an important step, and that is to end youth vaping. But when you start going in and banning products in such a broad way, I think it has a negative effect on the American economy. I think that it has an impact on people's individual liberties, and I think that we should step back from this component. We can deal with the youth vaping piece of this without eroding individual rights. And with that, Mr. Chairman, I yield back.
Thank you, Mr. Ferguson. I thank the panel for the testimony. I'm going to first turn to Mr. Raskin for any questions or comments he may have.
Mr. Chairman, thank you, and thanks to all of the witnesses for their testimony, and Mr. Pallone, Mr. Suozzi, I want to thank you both for your leadership on this legislation, the Protecting American Lungs and Reversing the Youth Tobacco Epidemic Act of 2020, which I strongly favor. I first learned about the vaping thing from a friend of mine who actually lives in New York City, named Meredith Berkman, who called me a couple of years ago and said that her son's school was engulfed in this epidemic where the vast majority of the kids were using this and couldn't stop. They were basically addicted. They were smoking in the bathrooms. They were smoking on the weekends. They were using the vaping product whenever they could. It's expensive. It's harmful. The kids are winded. They're, athletes who can't perform because they're using it. I assumed it was some kind of big city problem, but I started asking around in my district, and what do you know, in Montgomery County, Maryland, which is overwhelmingly suburban, and Carroll County, which is overwhelmingly rural, and Frederick County, which is a mixture of the suburbs and more country areas, everybody's dealing with the same problem. It's an absolute epidemic affecting our kids. So we are in a national public health emergency crisis over this vaping epidemic. And I've heard stories of people who actually are working for the vaping companies, going into public schools on anti-smoking campaigns where they say, whatever you do, don't smoke, but if you want to try it, you've got to try vaping. Do vaping instead. That's better. And then they target young people by marketing the product near school areas and where they know young people are going to be. Last year, a quarter of middle school students in America and half of high school students in America said that they had tried it. And 5 million, more than 5 million were users, and 1 million were using it on a daily basis. So that's a profound problem. At this rate, we are going to have millions of kids who suffer serious health effects and die prematurely from a smoking-related illness because of the vaping epidemic. I think this legislation is the very least we can do. It will ban the manufacture and sale of all flavored tobacco products and stop companies from targeting kids and teenagers with their advertisements. So it will get the flavored e-cigarette products off the market within 30 days, and thus we hope we can at least prevent future generations of kids from taking up smoking. We still have to deal with the public health epidemic of those who've already started it and are going to have a very hard time getting off of it. So I just want to salute the members of the committee for taking strong action quickly on this, and not phony action, and not something that's easy and insufficient, but something that really will make a difference in terms of advancing and protecting the public health. I'm glad that this legislation will invest in educational and public awareness campaigns to target and reduce youth tobacco consumption, and to strengthen public health programs that exist now on tobacco cessation and on educating people not to get into it in the first place. So with that, I yield back, Mr. Chairman.
Thank you, Mr. Raskin. Mr. Cole, you're recognized.
Thank you very much, Mr. Chairman. Let me start with you, Mr. Walden, if I can, and I want to get a couple of things just for the record. Isn't it true that as part of last year's spending bill, we actually raised the age for purchase of tobacco from 18 to 21?
Yes.
In other words, the activity we're talking about here is illegal, right?
And further, the FDA has authorities on where about the deemed products. They regulate in this space, and so they are addressing, and we've given them the authority, and they've said they will go farther as needed to stop this. We share this common agreement in terms of getting after youth usage.
So, and there's a lot of common ground here, I think, on this. And the same thing, isn't it true that and you made this point, but I want to make it very clear, isn't it true that this administration has prioritized trying to address e-cigarette youth usage?
Absolutely, and again, I would refer to what the Federal Food and Drug Administration put out in terms of they're going to go after this. They say very clearly if the FDA sees a product that's targeted to kids, the agency will not hesitate to target that product. Period. If they'll take an action against any product, regardless whether a product is cartridge-based, disposable, or flavored. If it is targeted to minors, its marketing is likely to promote youth use, or if the manufacturer has failed to take or is failing to take adequate measures to prevent minors' access.
Well, as you apply there, isn't it true then that the FDA, already has largely the authority that it needs to act this area, and is clearly using it pretty aggressively?
And intends to do even more. And remember, I referenced in my testimony the May 12th deadline where the companies have to get approvals.
Yeah. Given the fact that we just raised the age, we have the FDA and the administration aggressively targeting this, you think it'd be worthwhile to wait a little while and sort of see how successful these efforts are?
Well, I appreciate the question, Mr. Cole, and I fully agree. The other piece of this, though, that we should be addressing, and we are not, and for the life of me I don't understand, is the marijuana piece. Because in my state, they're using all these same terms cotton candy and everything else to create gummy bears that are marijuana laden. It's all targeted toward youth and adults, but it's really targeted after youth. So I've met with school officials who talk about kids showing up with those in their pockets. And so they're getting high in school with marijuana-based products that are clearly candies and other things targeted toward kids. And they're vaping using THC, and they're using the kinds of pods that Secretary Shalala showed with the acetate in them as the agent. And remember, as Dr. Burgess can tell us, your stomach does a good job getting rid of oil, but not your lungs. And that's what CDC is telling us is the part of the problem, they believe, is they're using the basically vitamin E oil. They vaporize it, you got the marijuana in there to get high, and then it goes into your lungs and you can't get the oil out.
Well,
This is an epidemic that we should be addressing, and for the life of me, I don't understand why we weren't able to pass that amendment in committee, but I sure hope that we come together on this. We shouldn't be
I
divided.
think you anticipated a question, actually, and I was going to put the same one to the chairman here. Why didn't we deal with THCs in this legislation? We all agree that's a big problem here and a big abuse. Any particular reason why that wasn't addressed in the legislation?
Well, as I said, the purpose of this is to try to deal with this vaping epidemic. I'm not saying we can't deal with the other, and we should.
But isn't that part of the vaping epidemic? The use
Well-
of THCs is actually the worst part in terms of loss of
I'm
life.
not saying that we shouldn't deal with that. I am not, I don't want you to get that impression. But I do want to say this, though. When you talked about the FDA authority, we've never questioned the FDA's ability to deem e-cigarettes a tobacco product, to address the advertising, to ban online sales. I mean, they could do all that, Congressman Cole, but they never have, and there's no reason to believe that they will. I've been arguing for years that the FDA should treat e-cigarettes and do all the things that are in this bill, but to suggest that somehow they're going to do it, there's
Well,
no
with all due respect,
reason to believe
Mr.
it.
Chairman, aren't they doing a lot more than the last administration did?
Well, I mean,
The last administration didn't do anything for the
President
FDA
said-
on THCs or any of this
I don't want to get
stuff.
into who did what. What I'm saying in
Well,
terms
I
of
wouldn't either if I were.
Democrat versus Republican, but all I'm trying to say is that if there's no reason to think that the FDA, which is essentially non-political, I mean, it's not a political agency, in my opinion, there's no reason to believe that their policies are going to change and that they're going to deem this a tobacco product, they're going to restrict the advertising, they're going to restrict online sales, they're going to ban flavors. The limited things that have been announced so far are very limited, and Congresswoman Shalala, I think, mentioned how limited it was. So that's why we think we need the legislation. I just didn't want to give the impression that the FDA's authority is being exercised in a meaningful way. I don't think it is.
Well, again, you and I just have to agree to disagree. Mr. Waldo?
You and I probably agree more than you and Mr. Ploner agree. The last administration did not use the authority that they could have. It was under this administration, and specifically Dr. Scott Gottlieb, when he was the head of the FDA, that made this a targeted issue. And of course, the president is leaned in very hard on this as well. And so they're trying to go after. Oh, I'm sorry. I should repeat myself. For the mic, Dr. Scott Gottlieb, when he was head of the FDA under the Trump administration, is the one who took the lead with the authority Congress had given the FDA to go after this targeting of youth. And Dr. Hahn is continuing that effort as the current FDA administrator. And there are deadlines in law as a result of what we passed in the Tobacco Control Act that require these companies to now get certification. And that starts, I believe, May 12th. And so, yeah, they are stepping up. They are using it. But again, kids are being targeted by these giant companies that now are buying up all the marijuana companies. And they are creating flavored products, including candies and everything else. And they're using the THC in pods that are in the black market, where they're also putting in the vitamin E. That's we should not ignore. And for the life of me, I don't understand why we are. We should be taking that up in this bill. If you're going to ban these flavors for adults, shouldn't you ban marijuana for kids?
Was there discussion of that in the committee?
We had some discussion about it, yes.
We, as a committee, have had some hearings on marijuana, and we are starting to talk about some of these things. But I didn't want you to suggest that we've rejected regulation of some of these marijuana products. It's just that we haven't come to an agreement on it.
Are you working on one? Do you expect legislation in the
We
near
had-
future?
we had a hearing
I just think that's a
recently.
more serious problem,
We
frankly.
had a hearing recently, and we're certainly looking at it.
I would just say, if I might, Mr. Cole, we didn't come to agreement on this bill, but it's moving. We should be able to come to agreement that we should not allow kids access to marijuana in a vaping product. Anybody support that or oppose that?
If I could, Mr. Cole, can I just
certainly, Mr.
interject myself? And I'd say to my friends that right now it is illegal under the Controlled Substance Act, and all of us have had to sort of confront the Safe Banking Act, which is sort of the very first instance of any legislation regarding marijuana in the House of Representatives.
I supported that.
And I appreciate that, and I think what ultimately will have to be done, because you and Mr. Ferguson are absolutely right, there's an irony here that has to be addressed.
That's right.
But we've got to start addressing it because we have 47 states that now are allowing some level of marijuana use when the statute under the Controlled Substance Act clearly makes it illegal. So it's already illegal. Vaping with marijuana under federal law is illegal. What we need to do is start normalizing and aligning these things and having appropriate regulation, as you suggest, with respect to vaping. But it's already illegal to vape with marijuana. Now, not in your state or my state under state law. So I appreciate what you're saying, and there's a bill sitting in the Senate called the Safe Banking Act that may get back here at some point, and we can put some testing and regulatory components on it. But right now, the FDA can't even test this stuff. So I thank you for letting me
Well, I want to
object.
thank you. I voted for that legislation as well. I want to thank you for your efforts. You put together a great bipartisan coalition on that, because I think you were addressing a problem that there's a lot of concern on. Mr. Waller,
And I fully support changing the federal law so we can have the scientists do the testing on marijuana, because the other thing we're seeing are all these claims on CBD oil. That CBD oil is great to use, it solves everything under the sun. I hope it does. But boy, it's being marketed as the great medical savior, and we know there are drug interactions, but they can't study that either. We got to get the science and the facts, so we should do that as well. And the chairman has been open to some of these discussions, and to his point, we have had some hearings on that. I think we can find common ground on the medical study of marijuana. We should have our scientists tell us whether.
thank you very much, Mr. Chairman. Mr. Ferguson, you had a comment?
Yes, sir, thank you. Going back to this, when you look at this from a medical standpoint, there are two components here that we've got to deal with. One of them is the addiction component. And as someone has said earlier, when nicotine is involved at a younger age, it does affect brain development. It is a real significant problem. And so there's the addiction component, and what we want to try to do is we want very much to try to limit the marketing, or we want to eliminate the marketing and the access to youth, okay? Because I agree with the statement that if someone doesn't start, if they don't use it as a child, they're less likely to start as an adult. That's very important. But then there's the real physical damage that occurs to the lung tissue. And that is something you can overcome with treatment and therapy. You can overcome the addiction component, but you cannot heal scarred lung tissue. That is a real problem. And so if we are real serious about protecting our youth, banning and working a piece into this bill to deal with the THC and the vitamin E acetate has to be a real component of this bill. Again, there is a real concern with addiction from nicotine and the problems that occur there, but this damage that's occurring at the tissue level because of the vitamin E acetate is a real problem. And if we are serious, I'll say this again, if we are serious about protecting children, we will make that a priority in this bill as well.
Yeah, let me ask you, and I'll probably just ask you collectively this, if any of you have any observations. And let me begin by, confession's good for the soul, Mr. Chairman. It's not a huge surprise to a lot of people around me that I do like cigars. So, and I was happy to see the premium cigar exemption in your legislation, but you know, there's a lot of elements to this bill that don't deal with youth smoking. They really deal with adult smoking. A lot of the flavor prohibitions and what have you. And you know, my subcommittee, and when I say mine, I mean the one I serve on approach labor age. We've, like you, we wrestle with this problem, and we've had a lot of hearings on this as well. And the consensus of the experts that we came in is not a big surprise to any of you. Number one, if you don't smoke, don't start. You know, if you don't vape, don't start vaping. Don't look on it as a substitute or a harmless thing at all. I couldn't agree with you more, Mr. Chairman. But it's also, if you're smoking cigarettes, you're better off vaping. And I have a lot of people in my district that will come to me and literally say, I used to smoke cigarettes. I vape now, and I'm better off. And the studies we have from England, it's 95% better off. You go to the English Health Service, actually encourages smokers to vape. This is sort of gets in the way of that, because this doesn't stop regulation at 21. This also interferes with a lot of adult choices and actually makes, I'm not saying they're healthy choices, but they're healthier choices than a cigarette, more difficult for an adult. Is that a fair statement? Is that
No, I would say not,
well,
Congressman.
you'd be in the minority in England.
Well, let me just say this. First of all, I didn't want, with regard to the cigar exemption, the premium cigar exemption, which is like less than 10% of cigars, is not to the flavors, it's to the online sales. So in other words, all flavored cigars are banned too. There's no exemption to that. It's an exemption to the online sales for cigars that are retail for $12 or above. So it doesn't affect our effort to try to just, to get rid of flavors and have the flavors mask the tobacco for kids. In terms of the cessation, that's the one thing I really want to contradict, and I mean, others can disagree with me, but this marketing of vaping as a cessation device, I think, is totally not accurate, right? In other words,
again, Mr. Chairman, with all due respect,
there are many ways. Depending on how you vape or what you vape, it could actually be much worse.
Well, if you absolutely could, if you're doing THCs, which we don't deal with in this bill. Yeah,
Just talking
Mr.
in terms of the nicotine content.
Mr. Ferguson.
Yeah, I'm glad you brought up the cigar component of this. You've got an exemption for high-end cigars, but you go hard after what you would call the low-end cigars, the cigarellas and those types of things. And one of the interesting components of this, and I'll let the ranking member speak to it as well, is the ACLU has come out in strong opposition to this bill. If you look at the demographics of who uses what in all of this, it really does create some significant issues. And then how do you ban one but not the other? If you're serious about it, then go for it all. You ban flavored smokeless tobacco, but not unflavored. You ban flavored cigarettes, but not unflavored. I mean,
Well, in terms of
and again, if you're going to go down that road and it is that significant, then let's go after all of this stuff.
Well,
okay?
let me say
But I think banning legal products that are legal today that adults choose to use freely, I don't think is the right approach. And I think when you start creating these imbalances where you target one group but not another, I think that's patently unfair.
Well, I don't want you to understand, if I don't want people to smoke anything, okay? But when you talk about cigars, remember, the exemption for premium cigars that retail for $12 above is not to the flavors, it's to the online sales. And as I said in the beginning, the problem with online sales is that kids, because they don't go to the store because they have to show their ID, they buy online, okay? Something like 10%, 50% of the cigars that are purchased online. About 10% of those are those premium cigars. Would I like to ban them all? Sure. But I don't think it gets to the youth tobacco problem. It doesn't make a huge exemption to the youth tobacco problem that we're trying to get at, which is primarily flavored tobacco and also online sales. And most kids are not buying these $12 cigars online. But I did want to say this.
$12 cigars anywhere, I can assure you.
All right, but the ACLU's concern with this is totally involved with the fact that they are concerned. It's like the Eric Gardner type of situation. They're afraid that somebody's going to sell a cigarette, a tobacco product on the street and be arrested and go to jail. Now, and be criminalized. What we did is when we came out of committee, we put in language that specifically said that possession of these products is not penalized. And then in your committee print, which is not exactly the same bill, it's my bill combined with Congressman Swayze's bill, has a provision that clarifies that state and local law enforcement may not enforce this federal flavor prohibition as this authority rests with the FDA. So what we're saying is that it's only the FDA that can enforce it, and that if someone is, picked up on the street, I mean, granted, a police officer may not know, and they could charge somebody, but then under this law, under the committee print that you will hopefully pass today, no one could be prosecuted for that by state and local law enforcement. It's just the FDA. The FDA would basically enforce the flavors prohibition on the manufacturers. It's the manufacturer, the import that is prohibited. And I don't believe there'll be a black market. There are about 28 jurisdictions now, states and major cities, that have the same kind of prohibition on flavors, and there's no evidence that in any of those jurisdictions that we have the concerns that the ACLU has
I
expressed.
appreciate it. Let me ask both the chairman and Mr. Ferguson, do you believe there'll be a black market if we pass this legislation? Because I do.
Yes,
I
I do.
I think you're going to have a huge
anytime-
black market.
Anytime that the federal government has banned things, there's always been a black market on it. There's no reason to think that, that there won't be here. An interesting question, does this bill allow for a study to determine whether or not the black market would in fact develop? Isn't that something that should be included? Isn't that something that we should be looking at?
I don't see how, if the manufacture and import is prohibited, that you expect there to be a black market. There's no black market now in any of the states that have done this. And there are some that have done it for many years.
With all due respect, Chairman, I actually don't agree with that at all. I think it's usually, that's one of the reasons we have such a THC problem. There's all kind of black market out there.
Well, look,
I mean-
gentlemen, I'm not, look, I can't be a soothsayer and say exactly what's going to happen, but I do think you've got to weigh the possibilities of a black market or somebody being arrested, even though the law says they can't be, against the fact that you have this public health crisis that we're trying to get at.
And we don't disagree on that. I mean, that's exactly why I voted for raising the age to 21. That's exactly why I support what the administration's trying to do, working through the FDA. I just think that's more likely as a sort of rifle shot approach, particularly aimed at youth abuse of vaping and smoking, to yield results than this is. I think this is actually overreaching, and there's a lot of questions around the legislation that I think, given time, I appreciate you guys are working on it in your committee. I admire that. But I don't think we have the information to legislate this sweeping a fashion right now. Mr. Ferguson?
Yeah, one of the concerns of the black market is what is actually put into those products. It's a real problem with the vape with the flavor pods too. When they come through the black market instead of coming through a regulated market, and you have heavy metals such as cobalt that are in the flavorings. That is very damaging to the tissue as well. If I have great concerns about what comes in that market. Do all of a sudden, do you have products coming in that people are buying on the black market that are laced with fentanyl? I mean, there are a lot of issues here. I understand that you can't be a soothsayer on this. None of us can. But I think that some common sense shows that we're going to open a door here that may create another series of problems.
My friend from New York had a comment he wanted to make.
Thank you, Mr. Ranking Member. We've been through this debate before with cigarettes. There was always a concern that when we raised the taxes on cigarettes, that there'd be a huge black market. And there is, to a degree, a black market that exists with cigarettes as well. But raising the taxes on cigarettes have dramatically decreased the use of cigarettes in state after state. My state is one of the best examples. So this is a proven technique to reduce the use of these products. And certainly, there'll be some consequences that we can't foresee right now. We don't need any soothsayers. We just need to look at an experience as to what's happened with this efforts when we try to address cigarette smoking in the past.
Mr. Chairman, or, excuse me, Mr.
Chairman in
Ranking Member.
exile.
Sorry, Mr. Chairman.
Permanent exile in my case.
I meant that only in a past honorific sense.
Well, thank you. I just want to point out that, to your point, Mr. Cole, while my friends on the Democratic side changed the bill to say it doesn't apply to, that states can't enforce and doesn't apply to individuals, they did not do that for possession of menthol cigarettes. Now, if you go to the Eric Garner case on the illegal chokehold, he was selling individual cigarettes, and that's what he got stopped for. And that's, I think, why, and I'm not going to speak for the ACLU or the National Action Network or for social for justice and these other groups, but we would ask the letter be you review it and it be put in the record.
Without objection.
But well, let me.
It doesn't say menthol is included.
But menthol combustible cigarettes would still be illegal products if H.R. 2339 were signed into law, meaning that an individual found to be possessing or purchasing menthol cigarettes or another flavored tobacco product could still be subject to criminal penalties under other statutes or under state laws. And, well, that's what our council says. ACLU has concerns about it. And we're talking 3 to 5 years here. And it doesn't address the illegal
For
market.
smoking a menthol cigarette?
Well, for importing, distributing, selling, you know, and so, I mean, that's, if you're banning, you're banning. And I don't care whether it's the FDA, let me just finish.
I just don't want to, I mean, I don't, how.
Are you banning or not?
You're
All right.
banning the manufacturer and the import, and the FDA goes after the manufacturer and the person that's importing it.
And
We
selling.
have a specific prohibition on any kind of enforcement by state and local police or authorities. It's only the FDA. And they go after the manufacturer. They're not going after the individual.
So are they going
selling
after
it
the
on
seller?
street.
Well,
Gentlemen, let's just have one at a time.
I was
The
gonna
reporter's
other
having a
criminal
heck of a
penalties.
time taking all that down.
I'm going to apologize to the
Well,
Chair.
I-
I've lost control of my questions, but I want to let Mr. Walden finish his point.
I thank you, because the point is, it's still an illegal product that triggers other statutes making you subject to these penalties and to other penalties under other federal laws. And so this is the crux of the matter. And again, you're not dealing with THC, you're not dealing with these other issues. You're going to create a bigger black market in this area, because we know from this summer there were knockoff jewel products lining store shelves. They were counterfeit.
Yeah, I get the last point I'll make, and then I'll yield back, Mr. Chairman, is I guess that's my concern. I think there's lots of issues here that would suggest we need to return this and keep working on it, because there's clearly some areas we can agree on. Clearly some areas we can agree on. And the THC thing, to me, is clearly one of them, but there's others, but I'm not sure we're ready to proceed with this. At least I have an awful lot of questions, and I'm not interested in inadvertently putting my constituents at risk of being prosecuted for what's been a heretofore legal activity that's pretty common. I am interested in working with all of you, and I think we've done some steps by raising the age from 18 to 21, by some of the initiatives undertaken by the administration to make some progress here. But I think we're biting off a little more than we can chew in this legislation. That's just my opinion. But with that, Mr. Chairman, thank you for your generosity with the time. I yield back.
Gentleman yields back. Ms. Scanlon from Pennsylvania is recognized for her comments and questions.
Thank you very much. I feel a little bit like I'm going through the looking glass here, because rather than this being some kind of precipitous action, it feels like it's about a decade too late. In 2009, Congress passed the Family Smoking Prevention and Tobacco Control Act, during which flavored cigarettes were banned. And that happened because we had evidence that flavors in cigarettes had been developed in order to lure youth smokers. And that is, in fact, what they do. As Mr. Cole said, if you don't smoke, don't start. This is a proven technique that the tobacco companies are using to get youth to start smoking. So we banned them in 2009, the cigarettes. But the tobacco companies just rebranded. So now we have things like banana smash cigarillos. If that doesn't lure you in, I don't know what will. But so basically, they just diverted the kids to other products. First the cigarillos, and now the vaping products. So it is a huge problem in Philadelphia and Southeast Pennsylvania, where I represent. The communities of color, low-income communities, are being targeted by the tobacco manufacturers, and they're luring in kids and getting a whole new generation of addicts. So our health departments have been trying to fight this, and I'm really eager to give them additional tools to stop this before it gets started. The health costs and the human costs are just too high. So I look forward to supporting the bill. I would be happy to do so.
Mr. Chairman, a letter from the NAACP and several other African-American organizations such as the National Black Nurses Association, the National Medical Association, Black Women's Health Imperatives, African-American Tobacco Control Leadership Council, Association of Black Cardiologists, that support the bill and say that the reason they support it is exactly what the gentlewoman said, that today the tobacco industry is using e-cigarettes to hook a new generation of African-Americans, young African-Americans, with flavors like bubblegum, mint, mango, and menthol. It's a public health crisis affecting over 5.3 million kids, and that's why they support the legislation. And I just wanted to...
Without objection, the document will be entered into the record.
And if I could also say, the language that's before the committee that we're asking be part of the print that comes out today specifically says that state and local law enforcement may not enforce the federal flavor prohibition, as this authority rests with the U.S. Food and Drug Administration. For this reason, law enforcement officers cannot use the federal flavor prohibition as a reason to stop, search, seize, arrest, or pursue prosecution, trial, or punishment for violations of the federal flavor prohibition. Any stop, search, seizure, arrest, prosecution, trial, or punishment that would result from a law enforcement officer claiming to enforce the flavor ban would be impermissible. And I don't know if the ACLU, came before or after this addition, but I think it addresses the concerns that the ACLU specifies in their letter. Thank you.
Okay. Thank you. I yield back.
Gentlelady yields back. The gentleman from Georgia, Mr. Woodall, is recognized for his comments and questions.
Thank you, Mr. Chairman. I find myself in agreement with my colleague. I feel like I'm looking through the looking glass, too. Tell me what happens now when, I'm trying to read through the Rules Committee print. I am a menthol cigarette smoker. I travel to Canada. I purchased 12 cases of menthol cigarettes because we're not banning them for my use at home. I bring them back across the border, no problem whatsoever. No ban on the importation of these products.
There is a ban on importation, and there's a ban on manufacture.
I carry them across the border. I'm not importing them. Is the intention of the language?
In other words,
as a citizen, I can bring.
You're importing them for your own possession?
I'm bringing all of these legal products back across the border, whether they're in my briefcase or in my pickup truck.
I would say that that you're probably not allowed to import them anymore after this goes into effect. But in terms of prosecuting, you wouldn't be prosecuted, but they'd seize them.
And what is our? I don't agree with my ranking member and my chairman on the banking bill, because I think if things are illegal, they ought to be illegal, and if you don't want things to be illegal, you should make them legal again. And I know my friend from Colorado.
I say to the gentleman, that's what we're trying to do.
I know absolutely that's what he's trying to do, which is why I'm so puzzled by us trying to ban a product that we make it perfectly legal for everybody to have and use. I'm perfectly allowed to have these cigarettes,
Well, because the
but
reason
I can't import these cigarettes.
Correct. Look, the reason is very practical. I mean, I'm trying to be a practical person here, not a theoretician. The problem is that we don't want it to be manufactured and imported by a manufacturer, right? We're not looking to go after the individual.
Okay. My friend from Colorado said that we didn't have to worry about the THC products because those products were already
illegal, and I tend to agree with him. Lynching is already illegal. We made it more illegal today. Tobacco smoking by children is already illegal. We're making it more illegal today. If this is a ban on flavored smoking products, I think Banana Crush sounds terrible. I did find banana cream online, which I thought sounded good. Strawberry cream was also online, as was banana strawberry cream. So you have a variety there. Lemon lime was there. Lobster butter was there, which did not sound attractive to me at all, but it seemed like it was being marketed to a high-end crowd. Lime sorbet, pure pear, blueberry and red apple, of course, was there. Grape was there. And I was taking great comfort in knowing that all these products were going to be gone until I realized this was a website advertising their 65% THC vaping products that were available at more than 180 locations within 50 miles of your home, as we sit here today. I am not at all convinced, talking to my high-end tobacco shops at home that sell these products, who do not allow you to walk through their front door if you're under the age of 21, who tell me that in their 65 and older clientele, cotton candy and bubble gum are their two most popular flavors. Among their senior citizens, cotton candy, bubble gum. And you're paying a premium for this, much like folks aren't walking into a premium cigar shop and trying to buy a cigar. You're not walking into these premium tobacco shops and buying these products. I was amazed by the hoodie demonstration earlier. I'm shocked that goes on. I wondered if it was a new dress code here in the Rules Committee, and I was excited about that. I'm less excited that it's used for these nefarious purposes. I think that's just awful, just awful.
Do you think someone over 65 buys a hoodie?
Not at all. The imagination of the human mind never ceases to amaze me. But of course, there's no place for that. But my hookah tobacco sales folks back home would say, try to fit one of those into your sweatshirt and sneak that into science class and see if that works out. And I know folks tried to work through the committee for a hookah tobacco exemption.
Well, hookah it's only flavors, the manufacturer of the flavored hookah tobacco that's banned. It's just like the cigars or the cigarettes.
What percentage of hookah tobacco do you think qualifies under that flavored category?
Look, this is what happened in the 90s before
that's actually a real question. It wasn't intended to be dodged.
I would imagine that in the 90s when they started to manufacture these, mango hookah, that the sales climbed. But all I'm saying is I don't want you to get the impression that you can't smoke regular tobacco, hookah, as opposed to these flavored manufactured things that you...
75% of all the hookah sold in America is flavored. Now, again, to be fair to you, you said in response to premium cigars, hey, if it was up to me, I'd ban them all. Sure. And I have no doubt that that's true.
I try not to get people to smoke them. Look, there's no difference between hookah and everything else. What's happened is that if you flavor the hookah tobacco before you put it in the, what is that thing called, a bong? I don't know. I don't even know what it's called. If you put it in there and it's flavored, then it gets rid of the harshness of the tobacco, which is why more people like to use it. And what we're saying is that masking of the flavor is what gets so many young people, and adults too, to want to use it because they think it doesn't have the nicotine and it's not addictive. Hookah is very addictive.
What was, if I could ask my friend from Florida, Ms. Shalala, what number did you use for how many high schoolers had used a vaping product in the last 30 days? It was something stunningly high. 26.7. What I see from those same studies on hookah is something under 4. Do I want to quash the 4% of teenagers who are experimenting with hookah tobacco? Of course I do. Of course I do. But the conversation, and it happens up here time and time again, we agree 100% on preventing kids from smoking. We agree 100% on preventing manufacturers from hooking kids on smoking. We agree 100% that no one should target children. And yet, here's a product that is by no one's attestation, a product targeting children. It is a
No,
product
that's not
that,
true. The hookah is very popular amongst kids. And even though it's illegal, they still flock towards it.
and by very popular, you mean the same studies that report that north of 30% of children are vaping report that fewer than 4% of children have tried hookah.
Well, all I'm saying is that with the advent of flavored products, whether it's cigars, whether it's hookah, or cigarettes, more and more kids are attracted to it because it masks the tobacco flavor. I mean, if people want to go, until the 90s, hookah was strictly tobacco. Maybe, you'd throw a clove in it or something in your house, but it wasn't packaged. Now they manufacture the hookah with the flavor, and that's what they send to the hookah parlor, and that's what people smoke.
No doubt about it. I remember back when beer was flavored like beer. Now, it didn't prevent me from trying it as a teenager, and it was absolutely awful, and I'm not a beer consumer today. But it turns out they decided to flavor it. Apparently, there's a demand for that. I don't think that demand is 21 and under. I think that demand is 21 and older. I'll stop with this because I just don't understand. This is something we can agree on. This is something we all ought to be on board together on. And yet, the way this is crafted is it's making it something that seems controversial. If we are convinced that flavoring vaping products, which we know are being utilized in large amounts by children, flavoring hookah products, which we know are not being used in large amounts by children, and also flavoring THC products, which you referenced several times in your testimony, Mr. Chairman, that you couldn't believe vaping hadn't been more aggressively regulated given all the incidences of last summer. Well, I'm blessed to have the CDC in the great state of Georgia, and I was as troubled as anyone in this chamber about unknown health risks that were coming out. And if you read the CDC's webpage today, they'll say, and I quote, THC-containing products are linked to most of these outbreaks. So in your very, and I don't question your motives in the least, in your very earnest testimony, you spoke about how much those health events of last summer affected you, that Congress needed to act in that way. The CDC has told us exactly why those things happened, because black market products, which is where we're moving with all flavored products now, but black market THC products were responsible for those. And yet today, we do nothing. Not a little bit, not a step in the right direction, not a I can't be a soothsayer so I can't guarantee it, but absolutely nothing to address the concerns that the CDC has aptly identified. I don't understand why.
Well, look, let me just say this. I don't want you to get the impression that the only thing we're worried about here is youth tobacco. I mean, adults too get, start to believe that these vaping products are cessation devices when I'm telling you they're not. They're just as addictive, if not more. Adults will start using hookah and other flavor products because they'll think that they are not addictive and they don't have any nicotine. I mean, you don't have to be young to be stupid, right? I mean, a lot of people who are older get hooked and hoodwinked into this stuff as well. I mean, I'm not saying to you that we're only trying to deal with this. We're trying to deal with anybody who's young or who thinks that somehow these things are actually not what they are. And that's what the tobacco companies do. Understand that the FDA has not said that these products, they can continue to be advertised. They are. You watch TV, you see vaping's advertised. They can continue to market to kids. And that goes back to what you said, Congressman Cole. It's very nice. I don't know if there's anything in this bill that the FDA couldn't do on its own, but they're not doing it. They're not doing it today. They have not said they're going to do it. So I don't know what to tell you. We tried in the committee to put together a bill that would address some of these significant problems. That's what you have before us. Does it address all the problems? No. Does it only deal with kids? No, it affects adults. I'm not telling you that, but I think it affects adults in a positive way because these flavors are hoodwinked with adults too who don't realize what they're getting into. I'm not talking about you. I mean, you know what you got into with the menthol, but a lot of people don't. They think it's not nicotine.
Your young people may be different from my young people. THC use is not going down
Well,
in
that's
my
different
district.
too. I'm not
It's
suggesting
going
we
down.
shouldn't address that. I don't want to
I've got 9 more months left in this Congress, as does the ranking member. I will take you at your word. If what you're saying to me is, this is all a process, and we're going to get to THC before you get out of here. But if that's not what you're saying, it strikes me, as my friend Alcee Hastings would say, golly, more than strange, that Banana Crush will no longer be available to adults in my district, though it is a legal product in America today. But Banana Strawberry Cream, which is an illegal product today, will continue to be available at 180 retailers near you. I don't know how I take that message into my high schools and say that we're going to reduce drug dependency in the months and years ahead. I yield back, Mr. Chairman. Gentleman yields back. To Chairman Pallone's point, this is a nicotine bill. This isn't a THC bill. The points that you've raised, Mr. Ferguson, Mr. Walden, Mr. Cole, everybody, as it reflects on THC, legitimate, okay? But this is a nicotine bill. That's the focus of this bill. And, you know, if you want to start working on a testing and research bill on THC with me, I'm more than happy and get so that our universities and our laboratories can properly study the stuff and get it out of the Schedule I of the Controlled Substance Act. I'm happy to work with you on that. If my friend would yield.
I certainly will
I
yield.
would like to work with him on
Okay.
getting that done.
Done.
Even more to the point of today, though, I appreciate you making that distinction. This is a nicotine bill. It's being marketed as a child smoking bill. It is not that.
It's
It is, in
about
fact, a
addiction
nicotine
to
bill.
nicotine and vaping being just an absolute way that kids get harmed, get hooked, and the purpose of this bill is to try to limit that in some fashion or another in ways that aren't being done today. And I now,
Thank you.
yield to the gentleman from New York, Mr. Morelli, for his, Mr. Morelli passes to Ms. Shalala.
Thank you very much. I have a bill that moves marijuana from Schedule I to Schedule III for research purposes. My co-sponsor is Matt Gates, Congressman Gates, and I'd be happy to work with all of you on that bill in particular. I think it's passable. Let me simply add for the record, with your permission, Mr. Chairman, teens find a big loophole in new flavored vaping ban from the New York Times. I'd like to add it to the record.
Without objection.
And let me repeat, we're trying to close some gaps in the administration's policy that leaves thousands of flavored e-cigarettes on the market. This is 1 pack of cigarettes. This puff is 1 pack of cigarettes. This is blueberry ice, by the way. Over 15,000 flavored e-cigarettes, e-liquids will remain available on the market, and this is an example of that, to fill the open systems. And this is what young people are hiding when they go to school. And we need to close these gaps as quickly as possible. The CDC has projected that if tobacco product consumption among teenagers continues at the current rate, 5.6 million of today's youth will die prematurely over smoking-related illnesses. 5.6 million kids. What are we doing here? If we can't prevent that, we all ought to go home. Thank you. I yield back.
Gentlelady yields back. Mr. Burgess from Texas is recognized for his comments.
Well, thank you, and I actually will have plenty of time to talk about this tomorrow on the floor, so I will prolong this. I do have several amendments, and I just ask, should I talk about those now, or do we wait till we're hearing amendments?
Yes, we'd like the gentleman to talk about them now.
please allow me. So the First Amendment is to strike the user fee increase. And this amendment will strike the increase in user fees from $712 million to $812 million proposed in Chairman Pallone's bill. This amendment additionally requires the Food and Drug Administration to provide an answer within 30 days to the committees of jurisdiction as to why they have not complied with Section 106A of the Tobacco Control Act, which requires biannual reports to Congress on the implementation progress of the Tobacco Control Act. The Food and Drug Administration submitted a report in 2012, but failed to submit its required report in 2014, 2016, and 2018. This Food and Drug Administration has collected nearly $712 million in tobacco user fees in 2019. And since we don't have the report, we're very unclear about the use of them. We should not increase tobacco user fees by $100 million without a full understanding about the use of such fees. So the next amendment would be a user fee increase contingency, and this amendment would make the proposed user fee increase contingent on the Food and Drug Administration providing the required 2018 report on implementation of the Tobacco Control Act. Representative Pallone's bill, again, increases user fees from $712 million to $812 million. It is entirely reasonable to make this $100 million user fee authorization contingent on the Food and Drug Administration providing a report that they were required to have submitted to Congress last year. I want to be clear, this amendment does not strike the increase in user fees. It simply requires that the agency do its job and report to Congress on the progress made in implementing the Tobacco Control Act. Finally, the last amendment is a sunset amendment. And this would impose a sunset on the user fee authorization, requiring a reauthorization in order for the Center for Tobacco Products to continue to assess and collect user fees. Every other fee program in the Food and Drug Administration requires reauthorization. The Center for Tobacco Products user fee program should be no different. Reauthorization provide Congress the opportunity to evaluate the program, hear from the agency and stakeholders on potential improvements. The Tobacco Control Act passed in 2009 and allowed for continuous funding of the Center for Tobacco Products exclusively by user fees for eternity. Just as a point of contrast, the prescription drug user fee agreements have to be reauthorized every 5 years. The medical device user fee agreements have to be reauthorized every 5 years. The generic drug user fees have to be reauthorized every 5 years. The animal drug user fee agreements need to be reauthorized every 5 years. The Center for Tobacco should be no different from other programs in the Food and Drug Administration that require congressional oversight and reauthorization. So those are 3 amendments that I'm going to be asked to be made in order before we conclude today. And I'll yield back.
It's Mr. Burgess's time.
Can I just actually yield on the amendments?
Sure.
Look, I said in the beginning, and I'll say that the whole idea here is to have e-cigarettes come under the same regulation as other tobacco products, whether it be the advertising, the warning, or the user fees. And the reason is because, you know, as e-cigarettes continue to rise in volume and become such a tremendous part of the amount of tobacco products that are being manufactured and used, it seems to me it's only fair that they should pay user fees just like anybody else. That's all we're saying in this legislation and with the provisions that came out of Ways and Means. And I don't see how you can justify saying they shouldn't be subject to the same set of user fees when they're taking up so much of the FDA's time.
And as you know, because we discussed this at length in the committee, this is simply an effort to get the Food and Drug Administration to comply with the reports it is required under the 2009 law to provide to Congress and has not done for the last 3 cycles. I'll yield back.
Gentleman yields back. Mr. Desaulniers from California. No questions. Ms. Lesko from Arizona is recognized for her testimony and for her comments and questions.
Thank you, Mr. Chairman. I do have a question for Mr. Walden or Mr. Ferguson. Section 201 of this bill, it's titled Advertising of Tobacco Products, says under this section it would be unlawful to market, advertise, or promote any electronic nicotine system in a manner that appeals to an individual under 21 years of age. I believe there's a concern that that's very vague. Like, how are you going to determine what appeals to a person under 21 years old? And then wouldn't that effectively, in your opinion, ban all advertisement of e-cigarettes? Either Mr. Weldon or Mr. Ferguson.
Well, it does appear somewhat vague, and I think it's very subjective. I was not involved in writing that particular part of the legislation. Perhaps the ranking member or the chairman would like to provide some clarity.
Concerns. We have heard some First Amendment concerns. Obviously, this type of approach is applied to alcoholic products. When you go to get a label for a beer, they look at the colors and everything else before they sign off on it at the federal level. And so I understand the approach they're trying to take here to not have our advertising targeted toward kids. We'd all agree on that. Devil's in the details, to your point. Perhaps the author of the bill could better explain what the intent of that language is.
Well, what I was saying before, I don't want to be repetitive, is that because under the legislation, e-cigarettes would be deemed a tobacco product, they are deemed that for all purposes. So right now, as you know, if you watch TV, you see vaping products advertised. You don't see cigarettes advertised. If you go to a NASCAR race, they can't advertise for cigarettes. They wouldn't be able to advertise for e-cigarettes. So it levels the playing field so that whatever you see now for cigarettes that's prohibited would also be true for e-cigarettes. But in addition to that, we say because of this crisis amongst young people, we've added that provision. So they want to make it clear that whatever advertising is allowed, which would be very limited in the way that it's limited for cigarettes, that it cannot be used to target kids. It's an additional layer of regulation.
Mr. Ferguson, you had something to add?
Well, it's one of the things that I think that's come out in this conversation is that there's some confusion here. This has been pushed as a youth vaping bill. Again, something that we can all agree on. I think across the board here, everybody sees this problem and we want to go after that and we can work together to fix this problem. But then it said, well, it's a nicotine bill, okay? Was it a youth vaping bill or is it a nicotine bill, okay? Are we going after youth or actually we're fixing to ban products for adults? And again, I would just ask this question. Have you, I mean, to go in and talk about youth vaping is important and we should do it, okay? But then, have you asked the people in your district, are you okay with us banning these specific products that are on the market right now? How many of your constituents know? How many have you advertised to through your newsletter to let them know? I'm sure you have let them know that you're working on a youth vaping bill, and that's good. But have you also told them that you're about to eliminate things like Grizzly smokeless tobacco, Newport menthol cigarettes? Have you asked that? Are they aware that that is about to happen? Because I'm going to tell you, I think when the general public finds out that a product that they have been using legally for years is banned, I think there's going to be tremendous pushback. And that could lead to the undermining of this bill down the road. We need to stay focused on exactly what this bill is supposed to do, which is to go after youth vaping and, quite candidly, address a real fundamental problem, which again is the THC and the vitamin E acetate.
Well, I don't want to...
Those are the important components. But I mean, again, I don't think people know exactly what you're banning here. And I think that's an important point.
I don't know what else I can say other than, the media or people can interpret what they want. I've never suggested that this is only addressing young people. I tried to make that clear to all of you today. The problem, the epidemic is amongst young people. That is certainly true. But we are deeming e-cigarettes a tobacco product. The FDA has always had the authority, as Mr. Cole and Mr. Walden have said, but they have not done it. So right now, you can't advertise cigarettes on TV. You can advertise e-cigarettes. You can't, we've banned flavors for cigarettes, but not menthol. So what we're trying to do here is say, look, we have a problem here. Flavor is a problem across the board. E-cigarettes should be treated like any other tobacco product. They are not less dangerous. They shouldn't be advertised on TV. They should not be advertised at sporting events where you can't advertise cigarettes. And online sales are a huge problem because whether it's cigarettes, cigars, e-cigarettes, whatever it is, this is where the kids are getting the product. So yes, there's a youth aspect of this, and that's the main focus, but these other things are important as well, and I don't want to, and I'm never suggested otherwise.
Well, I'm glad we at least now have a certain level of clarity on what we're trying to do here. It's not only are we trying to address a very serious health problem, but you are now going in and you are quite candidly telling the American people what they can and cannot do. And that's exactly what is happening here. You are banning a product. You are taking a product that is legal right now for adults, and you're telling them that they cannot have a flavored version of that. They can only have the unflavored version. I will go back to my statement.
That would absolutely be accurate.
Well, thank God we've got that clear. I yield back.
Thank you. I have a question for Mr. Pallone and Mr. Swayze. So Swazi.
The gentleman's name
Sorry
is
about
Swazi
that.
from New York.
Swazi.
Swazi.
Mr. Swazi, Mr. Pallone. I looked online, or my staff did, for all these marijuana products. They have like cold Joe coffee with marijuana in it, some kind of fruit drink, another fruit drink, a water drink, cookies, chocolate, brownie, candies. And so my question to you is, I know you're very concerned about the flavored tobacco. Would you support a ban on flavored marijuana products?
I think that the principle is similar. Yes.
So you would support a ban on flavored marijuana products then?
Well, the concern that I have with flavors is that they mask what you're doing, and people don't understand what they're doing as a result. So I certainly, look, we can look at it further, but I would tend to think that the same problem would exist. Now, you're going to argue, is nicotine more dangerous than marijuana? Most people tell me that nicotine is much more toxic and much more dangerous to your health than marijuana, so maybe we shouldn't have restrictions on marijuana at all, and maybe we shouldn't have any restrictions on flavored marijuana because the marijuana doesn't have the same health problems that nicotine has. So, maybe I should say, assuming that marijuana is dangerous, then maybe the flavored should be, but it's not as dangerous. I mean, I'd have to ask the gentleman from Colorado maybe, because in your state. No, but I mean, the reality is that we know that nicotine is much more dangerous than marijuana, so maybe the flavoring masking it is not as serious a problem as it would be for nicotine.
Well, that's actually if I might, that's actually
Yes,
the
Mr.
reason
Walden.
this Congress should have moved some version of legislation like Secretary Shalala has worked on or I've supported, so we can go and do the research to find out the answer to that very question. We have the jurisdiction to do that, we should.
And for the gentleman to say
But
that
we
that
know
it's
that
not, the
nicotine is
vitamin E acetate and THC using in the vaping pods is absolutely dangerous. It is absolutely causing tissue damage in the lungs.
The marijuana.
I feel like it was the debate.
It's the general.
Okay, we need
Ms.
control here.
Lesko,
I
it's your
asked the
time.
same
If you would
question
direct them, please.
to you, Sir. Would you support a ban on, I was afraid to say it that I'd say it wrong. Do you support a ban on flavored marijuana
While I
products?
support the use of medical marijuana, I'm generally not in support of the legalization of marijuana in any form other than that.
I'm sorry, I didn't hear you. I didn't
I'm not
understand.
in support of the use of recreational marijuana. generally, so.
Will the gentlelady yield? Could I follow up on your question?
Sure.
So if medical marijuana were being flavored, and then there was a huge youth or children's market that was born out of that, would you favor a ban on flavored medical marijuana?
Yes.
Okay, thank you.
Well, and Mr. Pallone, I'm going to end it because we're going to go on and on. We're just going to disagree. I just think that a lot of my Democratic colleagues, which I can agree on some issues, but not on other issues, you just believe government knows best, like how to run our lives, and I just disagree. But the thing about the marijuana, it is, flavored marijuana is dangerous. I mean, there's cases where babies, there's 11-month-old baby that died from eating these edibles. There's other cases of teenagers that have killed themselves after eating too much edibles, you know, because it's not the quantity. So I would just say that it is a serious issue. And with that, I yield back.
Gentlelady yields back. Does anybody else have a question for this panel? If not, we'll call up Mr. Griffith from Virginia for his testimony. Thank you all for your testimony. Okay. While Mr. Griffith is coming up, we'll enter into the record a statement from Mr. San Nicolas, who represents Guam, a statement for the record dated February 26, 2020. Thank you for being here. Mr. Griffith, you are now recognized for your testimony.
Thank you very much. I appreciate your time. I know that the hour is getting late, so I'm going to jump right in. I have an amendment which would be a prohibition against flavoring of marijuana products, which you all have discussed already, but I'm going to get into a few other little things, and I'm going to tie it in on germaneness. So bear with me. It's going to be easy. All right, here we go. From the transcript of the hearing on this bill in front of the Energy and Commerce Committee, Mr. Bouchon asks, additionally, this is where I'm going to focus my questions on. This was to Dr. Volkow, who is the director of the National Institute on Drug Abuse at the National Institute of Health. And he says, NIDA, her organization, recently put out research describing record levels of teen vaping marijuana, vaping THC products. Can you elaborate on that data? Dr. Volkow, yes, we have seen overall vaping has increased among teenagers in the United States. 40% of teenagers have vaped in their lives, and despite the fact that this is a new technology. 3 years ago, most of the vaping was related to flavors. 2 years ago, most of the vaping was related to nicotine. And what we saw this last December was there was a doubling of the number of teenagers vaping for THC. Now, considering the vaping THC delivers a very high content of THC, this is worrisome. It is also worrisome because, as you know, the acute injuries from vaping are predominantly associated with vaping of THC. From the National Institute of Health report, past year vaping of marijuana, which has more than doubled in the past 2 years, was reported at 20.8% amongst 12th graders, with 10th graders not far behind at 19.4%, and 8th graders at 7%. Past month marijuana vaping amongst 12th graders nearly doubled in a single year to 14% from 7.5%, the single largest one-year jump ever tracked for any substance in the history of the survey. The largest was from 2017-2018 with past month nicotine vaping amongst 12th graders. For the first time, the survey measured daily marijuana vaping, which was reported at 3.5% amongst 12th graders, 3% amongst 10th graders, and 0.8% amongst 8th graders. The report goes on. I will give this to you all for your consideration. Now,
It'll be entered into the record without objection.
Earlier in your discussion, and it is one of the interesting things about this bill because it may not be what they intended. They may have intended this just to be a cigarette bill, but I would submit to you it is in fact a vaping bill specifically related to all vaping substances And let me quote, and on my copy, it's page 9, but it's section 103(8) of the bill, and when you look at that, and here's what it says: electronic nicotine delivery system. Now, I don't know about other states, but in Virginia, we have a law that says if the top of a bus is white, it's really yellow for purposes of being a school bus. That all came about as part of the heat and energy crisis back in the 70s, and they've never changed it, at least not when I was there. So listen to this. The term electronic nicotine delivery system means a tobacco product that is an electronic device that delivers nicotine, flavor, or another substance. I submit, if I were the prosecutor in Colorado, I would use this. Or another substance via an aerosol solution to the user inhaling from the device. And then it goes on to include e-cigarettes, hookah, cigars, etc., and any component, liquid, part, or accessory of such a device, whether or not sold separately. Ladies and gentlemen, what we have is a vaping device bill. It's billed in part as an electronic device, but the language of the bill, the clear language of the bill says, or another substance. I submit to you, ladies and gentlemen, marijuana is in fact, THC is in fact another substance covered by the bill already. I think that my amendment makes it clear what we're doing so we don't catch people unaware of what's happening and make people who've heard the rest of the debate today but tuned out for this amendment because they've been told this doesn't affect THC. I submit to you, Mr. Chairman, it does affect THC. Now, it is true, and you all have already heard it, so I'm only going to touch on it briefly, but it was the only time I've ever made the roll call film at the end of the week of Humorous Things, because I brought this up in committee, and I was the first to bring up the flavor of marijuana, and we had Bootylicious. And apparently they liked the way my southern drawl said Bootylicious, and it made that little film clip where they do the hits and misses of the week. But Bootylicious is out there being advertised with a 21.5% THC level. And in her testimony further, Dr. Volkall, in front of our committee, said having young people smoking or vaping THC is a significant worry, not just because it's increasing, but because anytime you take that young brain and start introducing substances, whether it be nicotine or THC, you are changing the chemistry of that person's brain and making them more susceptible to substance abuse later in life. Some individuals will, some individuals won't, but her testimony was they're more likely to be involved later in life with abuse of substances, whether it be nicotine or THC. She did not distinguish between the two. She was very concerned about youth vaping. Now, we've heard all the things this bill doesn't deal with just with youth, but I'm trying to get to youth because I think if we're going to say that you shouldn't use flavors for nicotine products, we should also look at those other substances and say you should not have flavors out there, whether it's Bootylicious, whether it's cupcake, whether it's gelato. I've got one in here that's a gelato flavor. It's very popular, gelato flavored. You know, it tastes like ice cream and gives you the punch of THC. We ought to take action, or else we're going to be back in a couple of years thinking, why didn't we do that? As the gentlelady said a few minutes ago, we thought we got this in 2009. Let it not be said in 2029 that we had a chance and we thought maybe we were getting to it in 2020. Let's just go ahead and do it. Let's say you can't sell flavored marijuana, THC, vaping products. My amendment makes that clear. I hope that you all will find it in order and it'll be adopted on the floor of the House.
Thank the gentleman for his testimony, and I'll just ask generally, does anybody have any questions for Mr. Griffith?
Just want to say, I hope the gentleman's amendment's made in order. I think it's worthy of consideration.
No, thank you very much, and obviously the point has been well made by everybody, and
I understand.
we'll see where this all goes.
I have
Seeing
lots of
that
other
there are
flavors, but I know
no
you've heard them all.
questions, no questions for Mr. Griffith, you're excused. Thank you for your testimony.
Thank you all. I appreciate your time.
We're not quite ready with the rule yet, so without objection, the committee will. Oh, not yet.
We're not recording. Yeah, we're just
Trying
recessing.
to, are you messing with me?
No,
No, okay. No, without objection, the committee will stand in recess, subject to the call of the chair, and everyone's invited into the chair's office for something.
Okay.
Yeah, cupcakes. We're recessing, recess.
deadly disease was discovered, and for the CDC to have said this is related primarily to black market devices is of serious concern, and I would ask that again, just ask the FDA to consider that is the Walton Amendment.
Is there any discussion of Mr. Woodall's amendment, bringing up Amendment 14? Seeing none, all those in favor, please say aye.
Aye.
All those opposed, please say no. No. Wow.
Credit the chairman's charisma there.
Only the chairman's direct intervention, Ron. You have it.
Would you like a roll call? Gentlemen would like a roll call. The clerk will call the roll.
Mr. Hastings, Mrs. Torres, Mrs. Torres, no. Mr. Raskin, Mr. Raskin, no. Ms. Scanlon, Mr. Morelli, Mr. Morelli, no. Ms. Shalala, Ms. Shalala, no. Mr. DeSaulnier, Mr. DeSaulnier, no. Mr. McGovern, Mr. Cole.
Aye.
Mr. Cole, aye. Mr. Woodall.
Aye.
Mr. Woodall, aye. Mr. Burgess, Mrs. Lesko. Mrs. Lesko, aye. Mr. Chairman.
No.
Mr. Chairman, no.
Please report the total.
3 yeas, 6 nays.
That amendment is defeated.
Mr. Chairman.
Mr. Woodall.
Mr. Chairman, I have an amendment to the rule to make an order amendment number 6 offered by Dr. Burgess. This amendment would strike the increase in user fees and require the FDA to submit to Congress a written explanation of why it has not complied with the reporting requirements in the Family Smoking Prevention and Tobacco Control Act. You heard the doctor's explanation of his concern that those reports have not been submitted. I know everyone takes him at his word that, and thinking about our Article 1 hearing, why hadn't those reports been given to Congress, and why aren't we all equally outraged by that? Secondarily, I would share with you that I have heard numerous Republicans who are very sympathetic to the goals of this bill say, I have never voted for a tax increase before, and I'm not going to vote for a tax increase on this bill either. If that were not in this bill, they would be voting yes. This gives you an opportunity not only to exercise our Article 1 control over FDA, but also to win those votes over. So I offer amendment number 6 by Dr. Burgess.
Thank the gentleman for his amendment. Is there any discussion of Mr. Woodall's amendment? Seeing none, all those in favor, please say aye.
Aye.
All those opposed, please say no. No. The noes have it.
I accept that ruling, Mr. Chairman, but I do have another amendment.
Gentleman has another amendment. Mr. Woodall is recognized.
Dr. Burgess anticipated that the answer might be no to that amendment and crafted amendment number 7, which strikes the increase in user fees only for fiscal year 2021, unless the FDA submits to Congress the appropriate reports required under the Family Smoking Prevention and Tobacco Control Act. We talk so much about doing bipartisan things. Well, we did a bipartisan thing, and the Family Smoking Prevention Tobacco Control Act was designed to make a very similar important difference to the one that we're trying to make with this bill today. We asked for these reports as a part of making that difference. The administration has not cooperated with us, and if we do not choose this opportunity to exercise our control, on something that we all agree on, I don't know when we're going to start that. So I offer amendment number 7 by Dr. Burgess.
I thank you. You've all heard Mr. Woodall's amendment bringing up Dr. Burgess's amendment number 7. Is there any further discussion? Seeing none, all those in favor, please say aye.
Aye.
All those opposed, please say no. No. In the opinion of the chair, the noes have it.
I would like a roll call, Mr. Chairman.
Gentleman has asked for a roll call. Clerk will call the roll.
Aye.
Aye.
Aye. Mr. Chairman.
No.
Mr. Chairman, no.
Clerk will report the total.
3 yeas, 6 nays.
That amendment is defeated.
I'm willing to keep going until I get one, Mr. Chairman. I have amendment.
Can we reconvene in the chairman's office?
Amendment number 8 by Dr. Burgess. This amendment, as you heard him eloquently discuss, imposes a sunset on the authorization to collect user fees on tobacco products. again, I hope we'll talk about this in our Article 1 hearing, that there's one way to keep an administration from running amok, it's to make sure that Congress always has that reauthorizing, not just opportunity, but responsibility. And I offer amendment number 8 by Dr. Burgess.
Is there any discussion of Mr. Woodall's amendment on sunsetting? Seeing none, all those in favor, please say aye.
Aye.
All opposed, please say no. No. In the opinion of the chair, the noes have it.
I accept that, Mr. Chairman, and Mr. Chairman, I don't have any other amendments.
I thank the gentleman for his amendments. Ms. Lesko, it appears that you have an amendment.
I do.
You are recognized for offering your amendment.
Thank you, Mr. Chairman. I have an amendment to the rule to make an order, amendment number 12 to H.R. 2339, offered by Mr. Griffith of Virginia. This amendment amends the bill to include a prohibition against flavored marijuana products, stating that such products shall be treated in the same manner as flavored tobacco products. So I guess the thought is, if that my Democratic colleagues are concerned about tobacco and they want to ban all flavors of all tobacco, then I would assume they would agree that we should ban all flavors of all marijuana products. And I yield back.
Gentlelady yields back. You've heard the amendment from the gentlelady and also the testimony of Mr. Griffiths. Is there any further discussion? Seeing none, all those in favor of the amendment, please say aye. Aye. All those opposed, please say no. No. In the opinion of the chair, the noes have it. Gentlelady has asked for a roll call. The clerk will call the roll.
Mr. Hastings, Mrs. Torres, Mrs. Torres, no. Mr. Raskin, Mr. Raskin, no. Ms. Scanlon, Mr. Morelli, Mr. Morelli, no. Ms. Shalala, Ms. Shalala, no. Mr. DeSaulnier, Mr. DeSaulnier, no. Mr. McGovern, Mr. Cole. Aye. Mr. Cole, aye. Mr. Woodall. Aye. Mr. Woodall, aye. Mr. Burgess. Mrs. Lesko. Aye. Mrs. Lesko, aye. Mr. Chairman.
No.
Mr. Chairman, no.
The clerk will report the total.
3 yeas, 6 nays.
That amendment is defeated. Are there any other amendments? Seeing that there are no other amendments, where am I? The question is now on the motion offered by the gentlewoman from Florida. All those in favor, please say aye. Aye. All those opposed, please say no. No. In the opinion of the chair, the ayes have it. Chairman, on that, I would ask for roll call. Roll call has been requested. The clerk will call the roll.
Mr. Hastings, Mrs. Torres. No. Mrs. Torres.
No, that's okay.
Mrs. Torres, aye. Mr. Raskin.
Aye.
Mr. Raskin, aye. Ms. Scanlon. Mr. Morelli. Mr. Morelli, aye. Ms. Shalala. Ms. Shalala, aye. Mr. DeSaulnier. Mr. DeSaulnier, aye. Mr. McGovern. Mr. Cole. No. Mr. Cole, no. Mr. Woodall. Mr. Woodall, no. Mr. Burgess. Mrs. Lesko. Mrs. Lesko, no. Mr. Chairman.
Aye.
Mr. Chairman, aye.
Clerk will report the total.
6 yeas, 3 nays.
That bill, the rule is passed, and the ayes have it, and the motion is agreed to. Accordingly, the gentlewoman from Florida, Ms. Shalala, will manage for the majority.
And our friend Dr. Burgess will manage for the Republican.
And without objection, the committee stands adjourned.
Chairman, got a question?
Yes, sir.
Chairman's office reopened?
The chairman's office remains open for business, but with that, the committee is adjourned.
Can I say something?
Oh, yes.
I just want to thank everyone for this photo. Today, we passed Savannah's Act, and I think it was just such a wonderful thing to come in to this room and to see the new addition, that we don't just have to look at a bunch of old people.
Former chairs.
Please, yes.
You'll be happy to know she was an FDR Democrat.
On that note, the committee stands adjourned.